Rosina Chimbalani's daughter died of AIDS, leaving behind 2 children. Chimbalani now takes care of her grandchildren with money she gets from a government program in Malawi. The program provides funds to families like Chimbalani's to meet the needs of children and buy their school supplies.
This project has changed my life. If I didn't get a cash transfer, I would be miserable and might even have died by now, and the kids would be on their own.
Malawi, like many African countries, has been hit hard by HIV/AIDS. In Africa, orphan children in the millions struggle to survive. Many families are dependent on welfare. UN experts praise recent progress in providing support and antiretroviral treatments for people with HIV/AIDS. But in their latest report, they argue that programs like Malawi's will be difficult to sustain if contributions from donor countries decrease over the long term. Dr. Gottfried Himschel is the HIV/AIDS director at the World Health Organization.
The current economic context obviously doesn't make that easy, but decreased commitment is not an option, as it will eliminate all advances made over the last few years.
The report says more lives are being saved than ever before, and 8 developing countries are now able to provide HIV/AIDS treatment to all who need it. But for the first time in the history of these programs, funding has actually dipped. AIDS activist Asia Russell says now is not the time to deny help to HIV/AIDS patients.
This faltering response from donors is happening at precisely the moment that we know more about how effectively to respond to HIV in resource-poor settings.
Activists warned that gains made over the last 8 years, including a 17% reduction in HIV infection, could be reversed in part as a result of funding cuts for the US PEPFAR program.
PEPFAR funding, instead of the steady increase that had been committed to in 2008, has been virtually flat funded. The president actually requested a $50 million cut to the Global Fund, which is one of the most effective multilateral mechanisms.
Donor countries are announcing their pledges for the Global Fund to fight AIDS, tuberculosis, and malaria at their meeting in New York. The United States is the largest donor and has contributed more than $5.1 billion so far. Experts say the Global Fund needs at least $20 billion to sustain current programs. Vidushi Sinha, VOA News, Washington.